Well, I guess it's good afternoon, everyone, since it's officially past the noon hour. Thank you all so much for joining us. As Ali said, I am Jen Smith. I am the Secretary for the Pennsylvania Department of Drug and Alcohol Programs. Welcome to our webinar that is geared toward communication professionals to talk about best practices when you're reporting on the subject of addiction. A special thanks to our partner in developing this webinar, the Douglas W. Pollock Center for Addiction Outreach and Research. That's always a mouthful, but these great folks at Penn State Harrisburg have just done some really valuable work with us in the substance use disorder space. They're partners with us on our Life Unites Us Stigma campaign, and we're just really pleased in the partnership that we have with them. For the next hour, we're going to be joined by two additional wonderful professionals, Dr. Sean Fogler. Sean is a physician living in long-term recovery. He's also a tireless advocate for compassionate drug policy, and he uses his experience to educate and inform, to help reduce stigma, and to improve public health policy for both mental health and substance use disorders. Dr. Fogler has also done some tremendous work in the stigma space in a partnership with a couple of other organizations, ProA and Rereading. I think that's correct. Is that right, Sean? Did I get that right? Rereading?
Yes, correct.
Yeah, okay, you're nodding. And so we're really thankful to him for his work also around stigma and the use of language, and that's obviously why he's a panelist today. And then we're also joined by Aubry Whelan. Aubry is a staff writer with the Philadelphia Inquirer. She's covered a number of different topics since she joined that paper, but since 2018, she's specifically worked on the help desk, covering addiction and substance use in the Philadelphia area. Aubry is a great friend of our department. She often reaches out and asks clarification about stories, and we're just so pleased with the excellent reporting that she does, and particularly her use of non-stigmatizing language. And so that's why she's a panelist with us. It's great to have you both. This webinar happens to be taking place during the heart of Recovery Month. It is National Recovery Month across the country. And the goal throughout September is to come together to celebrate individuals in recovery, their stories and their families, and to offer hope for those who are still struggling. National Recovery Month reinforces the positive message that behavioral health is essential to overall health, and also that prevention really does work, that treatment can be truly effective, and people can and do recover. This month also amplifies the message of how we all have to work together to reduce the stigma that's associated with the disease of addiction. That's the work that we do each and every day in my department, because we know and have seen, proven time and time again, that stigma is what lies at the center of so many barriers that prevent people from getting help. So many of the initiatives that we have do center on stigma reduction. But we also know that all of us in the state of Pennsylvania can do better with the words that we use, with the images that we portray, and the language choices that we make. So even though we're all really, really busy and we have pressure to meet deadlines and we're trying to pull everything together all at once, it seems to be piling up, doing 6 things at the same time. It's still important that we pause and take a moment to think before we either speak or write or communicate in any way, because we can make a real difference in breaking that stigma cycle. So it's our hope that within the next hour, we'll be able to make your lives a little bit easier when it comes to reporting on addiction and your own stigma reduction work. So without further ado, I will happily turn the floor over to Dr. Sean Fidler.
Thank you, Secretary Smith. All right, is my screen visible? Is that a yes? Okay, great. So as Secretary Smith mentioned, my name is Sean Fidler. I'm a person in long-term recovery. I've been in recovery a little over 7 years now. Also practiced medicine in the Philadelphia area for over a decade, and also have been impacted by the criminal justice system. So, and heavily stigmatized, because of my actions and my story. And so I've experienced so much of this firsthand, and am very passionate about it. And all of my work is fueled by my experience. And so I brought a lot of material today. I'm going to probably talk fast, but I figure you can take this away, and I'm always available for questions. So today, for the next 20 minutes or so, give you, kind of a little introduction on drug policy, which will be very fast. A little background on addiction, the disease of addiction, drug use, and then stigma, and share a little bit of my research. And some of the slides at the end are really for you to just take away. And so, to begin, as many of you know, we're in the midst of this public health crisis, and we've really been in this crisis for decades. And this crisis affects all of us, substance use, addiction, recovery. It doesn't look one way. There is no one way. And you probably recognize many of the people on here. None of them are alive, unfortunately. They're all not with us today. The upper right-hand corner is a judge from North Carolina who overdosed and died. Just below him, a little bit to the left, is a prosecutor. And I do a lot of training with law enforcement and different stakeholders in the criminal justice system. Physician myself, I know many colleagues, that have struggled with this disease. I was in the Physicians Health Program in Pennsylvania. We are all human, and we all suffer from this disease and struggle with this disease. And it, as much as it looks different for different people, but we're all people, and it impacts us. And when we talk about drugs, drugs are everywhere. Drugs are ubiquitous in our society. They're used all over the world. And if you look at this, these substances, right? We use caffeine, we smoke cigarettes, we drink alcohol, but even cocaine, cocaine is a Schedule II drug. It's used in operating rooms. It's used in medicine. Interestingly, there's massive disparities between powder cocaine and crack cocaine in terms of, criminal justice consequences, right? It used to be 100-to-1 disparity. During the Obama administration, it came down to 18-to-1, and now we're fighting to have them being treated equally in the courts, which is just, it really speaks to really flawed policy. A lot of it is rooted in racism, and we have a long history of this. The heroin bottle here is, we used to prescribe heroin back in the day. Marijuana, depending on where you are, is legal. And really my point here is, drug use is everywhere. Drugs are in our society. Not all drug use equals a substance use disorder or addiction. And it's, we have to think about these things. And really, what role do you play as media professionals in highlighting drugs, what they are, and who uses them? How do we define the people that use them? Drugs are used all over the world, traditionally. And, this is from the Global Drug Policy Commission in 2017. Things like cocoa leaf in South America, tobacco here, alcohol here, obviously. But drugs are used all over the world. And if you look at this, and I don't know if you can see it here clearly, but the harms to drugs vary quite widely, and the legal drugs are some of the most harmful drugs. If you look, at the top, like alcohol tops the list, right? And tobacco is not too far down the list. And there's a whole slew of drugs, and some of these are therapeutic. Ketamine is being used for depression today. Things like buprenorphine, right, for opioid use disorder is used, and it's way down the list. Benzodiazepines for anxiety, cannabis. And the point here is it's really arbitrary where we draw these lines. And it's no surprise, right? We have a long history of drug policy. You probably remember this guy or have seen some videos of Richard Nixon, who really declared war on drugs and the people that use drugs. And there were a lot of reasons for that. Really, a lot of it really had nothing to do with drugs and the harms of drugs, but more about, controlling different groups of people. And obviously race, plays into this in a massive way. And that's, we could talk about that for quite a long time. We could have a whole other talk. But I think the exciting thing is that today we are seeing, a shift from really public enemy number one to a public health approach. It's never fast enough for me, but it's like turning a giant ocean liner. And I think, there's a lot of exciting things happening federally, statewide, that are shifting to a more compassionate approach, an approach that's rooted in science, not myth and misinformation. But we still have a long history and deeply rooted ties to these misperceptions of drugs, and misperceptions about the people that use drugs. And if we're really honest with ourselves, I can't imagine there are media professionals on this call that have never used drugs, right? I know there's plenty of physicians that use drugs, lawyers, and so, we have to think about, if we're really truly honest about drugs and drug use in our society, they're everywhere, and people use them from every walk of life. The Biden administration has really made these prevention, harm reduction, treatment and recovery, supply reduction priorities. Harm reduction is new and exciting. It's not a new philosophy or strategy, but it's new to our drug policy. I think we need to see more of that, but there's some exciting shifts going on. Despite that, we still arrest a large number of people for drugs in our society. And if the orange bars are possession, the yellow ones are traffickers. And the reality is, people that are actually trafficking drugs in a significant way make up a very small subset of this group. And our jail population, we have seen about 1,000% increase in the number of people incarcerated for drug offenses since the 1980s. And, we incarcerate more people in this country than anywhere on earth. This has been our strategy. And the reality is it's been our strategy to address mental health and substance use issues. And the interesting thing is that very strategy actually fuels the disease. And so the media has played a significant role. Lots of myths and misinformation, sensationalistic headlines, crack babies. Really, there was no such thing. Babies can't become addicted. The upper right here, this was a recent release. I think it was a sheriff in Tennessee, and I work with a lot of sheriffs, so not to point the finger, but this one sheriff in Tennessee, was put out a public service announcement about not touching dollar bills. And my first question was, what about the 10s and the 20s? But anyhow, there's a lot of misinformation, and you probably recognize one of the people in this collage here, and this here, I don't know if you can see my mouse, but near the bottom, second from the left, is actually me. That actually was my mugshot when I was arrested. And one of the kinder headlines was that I was trafficking drugs, which was beyond sensationalistic. And I'm not going to go into the details of all that, but that was the exciting narrative among some of the other, details in there. And, it was a much better narrative than, this was a doctor with a substance use disorder that was struggling, right? This person was trafficking drugs and doing harm to the community. And that, what they didn't tell you is that I was about 1.5 years into recovery in that picture. I was doing a fellowship in addiction medicine at Cairn, which I had just started. And none of that really came out. And interestingly, and I'm going to share this here, I was at a probation termination hearing recently because my ultimate sentence was 5 years of probation, and I was about 4 years in. And the prosecutor at that hearing just doubled down on the same narrative. And this was only a few months back. And, I bring that up because, you hear this narrative, this, the rhetoric of we can't arrest our way out of this, we need to support people in recovery. And that's the antithesis of that. And interestingly, the two people I brought to support me at that hearing were both law enforcement professionals. One who had a 40-year career in law enforcement, one about 30 years in, who had worked in that office. And at the end of the hearing, one of them said to me, "Sean, they just don't understand. They need to learn." And the other one turned to me and said, "I am embarrassed for our criminal justice system today." And that's what happens. And if that's my experience, what is the experience of others, right? Who may not have the resources to protect themselves, And so my point is we have to do much better. And this really, the media, our approach really fuels this, vicious perception of people who use drugs, right? The negative portrayal, drug use is immoral, people are dangerous, they can't be trusted, right? And that fuels stigma, and that stigma, drives discrimination, and it actually fuels the disease in a massive way. And we see this here, right? 300 people dying every single day. Every 10 days, we have a 9/11. Every 10 days, 3 times a month, right? We have to do better. And this is a complex problem. I don't want to simplify it, but I think the media plays a very powerful role in shaping how we think about these issues, how we address these issues, and how we can change, really shift the course of what we're doing. I would almost say you're at the tip of the spear, right, as media professionals, which is exciting, but also challenging and a massive responsibility. In terms of addiction, right, we have this brain disease model. And I just want to say, addiction is extraordinarily complex. The more I learn, the more I realize I don't know. And the more, there's so many different angles. And I think a lot of times we simplify it. And I understand, especially as media professionals, simple, clear messaging is so important around this stuff. But how do you, and maybe Aubry will talk about this, but how do you write about such a complex issue in a simple way? Because the issue, there's so many grays, right? It's just, and I think we leave a lot out and we don't contextualize things enough. And it creates these false perceptions and ideas. And the reality is, first of all drug use is an addiction, but when you get to the point of addiction, or and you have a severe substance use issue, it's a treatable disease. This is a chronic disease like any other disease. It is treatable. I stress the complexity. Genetics are involved, environment is involved. The other thing I just want to say about this is, and this is the Nida model of addiction, is that if you notice, the drug is at the center. And the drug has always been at the center, and we need to put people at the center. And I think it's something that's flawed with this model, because our approach has really been about the drugs, right? Don't do drugs, things will get better. Go to treatment, things will get better. It's so much more complex than that. And this is the other part, and people don't always mention this, that's part of the definition of addiction, that people with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. I can't repeat that enough, because that is our approach, right? Whether it's jail, whether it's shame, stigma, discrimination, if we punish people, if we make it bad enough, they won't do it. And it doesn't, that actually fuels the disease. It just doesn't not work, but it actually makes the disease worse. And this is why people die. we're getting, in terms of language, this, we shouldn't really be using relapse, but I like the picture here, really recurrence of use, like the appropriate thing. But, addiction, a substance use disorder, is just like any other disease, diabetes, hypertension, asthma, but we don't really treat it that way. And this is just for you to take away. This is from the DSM-5, the Diagnostic and Statistical Manual. And it looks at a substance use disorder with these 4 categories: impaired control, social problems, risky use, physical dependence. I've experienced all of this. This is a really, like, kind of, it's simple, but it really clearly kind of defines the disease, right? Using more of a substance than intended, wanting to cut down and not being able to. And some of you, may have experienced this yourselves, or know a family member who's experienced this. And it's really the categorization of this disease. They look at severity, right, on the severe end, and it is a wide spectrum, right? Most substance use does not lead to addiction. But at the severe end, it does. And, treatment is one pathway. And, I put this here: treatment ends, the journey begins, because the reality is, and I went away to treatment for 4 months, the real journey doesn't begin until you walk out of treatment. And we really need to support, these recovery-oriented systems of care and all the things that surround it. Like, we need to create, there's all this opioid money coming. We need to create this robust, like, framework, because it's a lifelong process, and it waxes and wanes, And I know we don't have time right now to look at some of these questions, but imagine if we treated other diseases as we treat addiction today. Imagine you're a diabetic and your sugar is high and you're told it's your fault. You're making poor choices and they deny you care, right? You only get medication if you agree to do what your physician says, and you're kicked out when your sugar spikes, right? You're denied employment and housing because you can't manage your sugars. Maybe you're jailed, right? This is how we treat addiction. We say it's a disease, but we don't really treat it like one. And then, on the hopeful side, imagine if we treated addiction like any other disease, right? No prerequisites, many options. From kind of where I sit, I think, like, somebody with a severe substance use disorder, we should be treating it like a trauma. It should be, like coming into the ER, and you get, this intense care. And I know it's expensive and costly, and it takes a lot of time to, like, really unearth a lot of these, issues and get to the heart of the matter. But the reality is, it's costing us a fortune as it is, right? And we need to invest in better care. And, I've kind of hit this point home, so I won't repeat it. Well, I'll repeat it one more time. Most people who use drugs do not develop a substance use disorder. And I love this quote. And, I heard Gabor Mate is a physician in Canada who worked in the downtown East Side, which is an area like Kensington and Philadelphia, for 30 years. He speaks all over the world. He wrote an amazing book called In the Realm of Hungry Ghosts. Some of you might know it. But I was listening to a video with him, and he brought this quote up, and it's very true. Like, he talks about working on the downtown East Side with people with the most severe substance use issues, and that everybody, like, the underlying issue is this pain, whether it's trauma, emotional pain, physical pain, like these are the things that, like, drive the disease. And we frequently don't ask about that. It's more, go to treatment, stop using drugs, everything will be fine. And we don't look at the underlying issues that are driving the disease. And the reality is, emotional pain and physical pain are both experienced in very similar areas of the brain. So when you're shamed, when you're stigmatized, when you're discriminated against, it feels like getting cut with a knife, and that's, nothing is more painful. Recovery, I don't know if anybody's life looks like the one in the upper left. I always say this: if it does, please email me and let me know what you're doing. I think recovery, like life, is all over the map. You know, it's up and down, but the reality is a lot of our approach, you know, kind of looks at it very binary, like all or none. It's a straight line. You know, you have to follow this path. If you don't, you're punished and shamed, and frequently discarded. And that doesn't work, you know, and it really is a process of change. You know, SAMHSA has a definition through which individuals improve their life. And there's 10 guiding principles. I'm not going to list all of them, but, you know, hope, person-driven, addresses trauma, strengths. And I think we need to hold any solution that we put out there to these guiding principles, right? Are we doing things to lift people up, give them recovery capital, and help them get to a better place, whatever that means to them? The reality is most people recover. And I was thinking about this, you know, like I do a lot of like healthcare related training, law enforcement training, and I know like those groups see the most kind of challenging people cycling in and out of the system over and over. And so their perception is nobody gets better, right? Because they're seeing that. And you know, I myself, when I was practicing, the same thing. But the reality is, and this was the Recovery Research Institute at Harvard put this out, that, you know, of the almost 30 million people, you know, who identify as having a substance use disorder, 75% identify as being in recovery today. So the reality is most people recover, you know, and recovery isn't necessarily abstinence, right? And so, but the reality is most people recover, most people end up leading healthy lives, healthier lives. Most people become an asset to their families and their communities. They're not lost causes, you know. And briefly, I'm just going to touch on stigma super fast, and then I'll hand it over to Aubry. But, you know, what is stigma? The more I research stigma and read about stigma, stigma is so complex. I will try and simplify it. This is like a classic definition. You know, an attribute, behavior, or condition that is deeply discrediting, and maybe it's a substance use issue. You know, maybe it's you have a criminal record, maybe it's a disability. I mean, there's a whole host of things. I think something that's frequently left out is that it's also a language of relationships. And what this is really getting at is that somebody who has experienced extreme, you know, stigma, everywhere they go, every person they talk to, every interaction with the world, they're constantly in the back of their mind, am I going to be judged? Am I going to be shamed? You know, they're always guarded, right? Can I be myself, right? Without being dehumanized. And the reality is, for people with substance use disorders, you really are in this cage. You're kind of locked in because the judgment and the shame and the discrimination is vast and touches every corner of our society. And I think, you know, a lot of that, you know, a lot of that's rooted in our drug policy, and then how the media has portrayed drugs, people that use drugs, and then, you know, all the different things related to drugs in our society, whether it's, you know, legal related or some other issue. And, you know, this is a classic model. And when I look at this, you know, labels, stereotypes, separation, status loss, and discrimination, I think the media plays a role. Like, I was thinking about this in every single one of these, you know, which, you know, back to my initial thing, like you are in a position of great power when it comes to shaping how we see drugs and people that use drugs, and can combat some of this, putting people, labeling them, putting them in an out group, this kind of us and them experience, which is really powerful. And it's interesting because there's this sociologist, Charles Cooley, who is an American sociologist, and he has this concept of the looking glass self. And the simplest way to put it is that I am not what I think I am, and I am not what you think I am, but I am what you think I think you think I am, right? And so that probably sounded way too complicated, but what it is that our perception, my perception of what you think of me, right, defines my social identity. And if you, and if what I'm reading in the paper, how I'm being treated, say in the hospital, or in some other area of life, I'm judged, discriminated, shamed, you're a drug user, you're bad, you're dangerous, you're a criminal, right? That is going to lead to all these different things, discrimination. And there's plenty of examples of this: avoidance, secrecy, delayed help seeking. We don't have a culture where people feel like it's safe to actually reach out for help, right? Shame, and I'm not talking about healthy shame. I'm talking about toxic shame, shame that destroys, right? Shame to me is like one of the most powerful and potentially destructive emotions. And diminished self-worth, and all these things drive the disease of addiction. Like if you want to, and Gabor Mate talks about this, he's like, if I wanted to design a system that would fuel this disease, destroy people and destroy communities, I would design exactly the system that we have today, and that's got to change. Label avoidance, denial. I mean, we could have a whole talk on each of these things, but the impact is vast. And so I've been a bit obsessed with stigma, as you might ascertain. And so last year, we deployed a study to over 30,000 Americans in the United States on substance use and recovery stigma. And we used a unique technology, but we got some interesting insights. And I'll just share a few with you. 71% of us believe that society at large considers those who use drugs problematically as outcasts or non-community members. And we could have a long discussion on each of these, but I'll just say, think about that for a sec. Like over 70% of us think that these people are outcasts and they're not community members. Like, what impact would that have, right? And how does that, some of you that are writing about these issues have these beliefs too. And so like, how does that impact, what you write, how you write it, right? 69% believe that others view people who use drugs as somewhat, very, or completely inferior. 74% believe that most others view people who use drugs as somewhat, mostly, or entirely responsible. And this is really important because we know, like stigma, like cause and controllability, if we believe somebody's caused their disease and they can control their disease and they're not doing it, stigma is off the charts, right? Versus, let's say, somebody who gets cancer, right? They didn't cause it, they don't control it. We wrap our arms around them, we support them. We don't do the same for people that use drugs, people with addictions, right? And that in the end is the solution. Like when we talk about solutions for stigma, which I'm not getting into all that today, but one of the most powerful things is closing the social distance gap, is bringing people closer, not deepening the lines and pushing them to the fringes. 28% view people who take medication for their addiction as always in recovery. Now, we just completed a study on healthcare professionals, so we're going to have a lot of data on that. Healthcare professionals are even lower than this. Like, we talk about medications for opioid use disorder, which we know work, right? Healthcare professionals, they believe people who take medication are the vast majority of them are not in recovery, right? So how does that impact them delivering care or delivering these medications? And we know most of them, aren't don't want to prescribe these drugs and don't want to deal with this patient population. And that's more that we could discuss. 73% of us believe that others view people who use drugs as having moderate, low, or no chance of maintaining recovery. I mean, think about that for a second. If at baseline, 3/4 of us think that, no, these people can't maintain recovery, how's that going to impact our care? How's that going to impact how you write about these issues? How's that going to impact, our policies and our practices and what we do? It's going to have a pretty, important thing. And I think Aubrey's going to get into this, but these last few slides are really for you to take away. Language is critical, how we talk, using the right words can be healing and supportive and lift people up. Using the wrong words, can really dehumanize people and fuel a lot of implicit and explicit bias, right? And that doesn't just affect the individuals, but it affects society at large, right? How we see these people. And there's a couple slides at the end. A friend of mine actually runs the John Stoltman reporting on addiction. There's some great resources on their site. This is Pennsylvania specific data. When we did that the study that I mentioned, we surveyed over 30,000 Americans. We oversampled PAs, so we had about 10,000 respondents in Pennsylvania. So this is for you to take away. And I threw down some questions. I mean, there's so many questions, but what does stigma look like for the people you write about? What impact does your message have? What's the societal impact? And what role will you play in addressing this public health crisis? And that is it. Thank you so much. And I guess on to Aubry.
Yeah, thanks, Sean.
Okay.
Hi, everyone. I'm just going to share my screen. Give me 1 second. Sorry. Am I sharing this? Sorry, did that work? Okay, this worked. Great. Thanks everyone for being here today. I really appreciate it, and I'm glad that people are thinking about these really important topics. And thank you, Sean, for your wonderful presentation. I learned a lot myself, so thank you. And also, you defined a lot of things that I just didn't bother to in this presentation, so you are helping me here. So thank you. So I'm a staff writer at the Inquirer. I've been there since 2012, so this month is actually, I'll be 10 years at the paper, which is pretty nuts. And I've been writing about addiction and substance use in Philadelphia since 2018. But I had been, because it touches so much of our lives, and because it touches so many aspects of daily life in Philadelphia, I had written about addiction in a number of different contexts, in a number of different ways, on a number of different beats before I started covering it full time. So just to start out with the way that we've reported on addiction over the years, noted the war on drugs era versus the opioid epidemic, but we really can't begin to talk about the war on drugs without pointing out that the war on drugs is not over. The policies and the attitudes that it spawned are still pervasive in policing and healthcare and the culture at large today. And the heavy stigmatizing of drugs and drug use and the resulting mass incarceration has disproportionately affected people of color. So we also can't talk about the war on drugs and the opioid epidemic and destigmatizing language without acknowledging the racism inherent in all of it. And that's something that I've really tried to acknowledge more of as I've, over the years on this beat, really digging into some of the very real health equity issues around this epidemic that are, playing out even today, and getting worse even today, to be honest. But so, in the, 80s, 90s, previous kind of overdose epidemic, stigmatizing language was sort of a default. There was, like Sean mentioned, there was this panic over crack babies and super predators, characterization of people with addiction as less than people, and casual use of extremely derogatory terms in media for people who use drugs. Reducing people with addiction to their condition, not describing them as a full person. And when you contrast that with the opioid epidemic, it gets kind of much more respectful treatment. This is a good thing. Stigma is still massive, but reporters and other people who shape public perceptions are writing and speaking generally a lot more thoughtfully about addiction these days, which is great. But at the same time, it's really important to acknowledge how people who use drugs were stigmatized when the overdose crisis was less widespread and, frankly, less white. And it's very, very easy to echo stigmatizing language, even when you're not trying to. So here's an example of stigmatizing language from my paper in 1993. They wrote, "Crackheads and pipers staggering and scurrying in the hallways past children playing in slippers." And this is a quote from me in the Philadelphia Inquirer in 2016 before I was on the beat. He remembers the crime and the drugs and the addicts who roamed the towers. He also remembers his mother, opening her door to neighbors who needed food or a place to stay. So the first quote is an excerpt from a story about public housing police in Philadelphia in the 1990s. Spent a lot of time talking about how bad the conditions were in Blumberg, which was one of the tower-style housing projects in the city. And so for this article in 2016, Blumberg was being torn down, and it was part of this huge neighborhood revitalization project that was also very controversial. There was a lot of issues at play, but I was covering the destruction of the tower itself, and I spent a lot of time talking to people who had lived there about how they felt about it. So this was an interview with a man who grew up there, who kind of acknowledged the poor quality of life that he kind of grew up in at Blumberg, but he also wanted to highlight the people who lived there really cared about each other. And this was a direct contrast to a lot of the articles that had been written about Blumberg in the past. I remember going to the Temple archives where we keep our huge, vast repository of historical inquirers, and asking them to pull articles on Blumberg, and it was just this very, you could almost see a change from when it opened, and it was like, this was great, and then immediately, maybe 5 years later, it was, well, not immediately, 5 years later is not immediate, but the paper, there's, there were these articles just describing it like it was another planet. It was really kind of disconcerting to read. So I didn't want to do that for the story, but I did kind of do that in the story. So in writing the sentence, first I used the word addict, which we have basically banned from our paper at this point. And I also was unconsciously or consciously contrasting people with addiction against the good people in the tower who were helping out. Public drug use can be really disturbing and upsetting for people who live around it. I kind of encounter this tension a lot these days when I'm writing for Kensington in particular, where drug use is really visible. But the way that I described people with addiction in this sentence is dehumanizing. I said they were roaming the towers versus opening their doors to help. I really regret this sentence because I tried really hard to honor the experience of Blumberg residents in the story, and this was an easy fix, I think. I could have probably said something about how, yeah, it was alarming and scary for kids at Blumberg to see people using drugs in the open, instead of using a whole group of people as a shorthand for a nuisance. And I try very hard to these days, especially in Kensington, not to do that while I'm reporting about some of the very real tensions that exist in that neighborhood, and some of the very real, living conditions that result from a vast open air drug market and, a completely inadequate treatment system. So I was not covering addiction at the time when I wrote this sentence, and I've been doing it for almost 5 years. I've learned a lot, and I'm sure that I will continue to learn more. Let's talk about how we approach addiction while reporting, or how I've kind of learned to do it over the last few years. As reporters, we do this really delicate dance between getting a good story and respecting the people whose stories we're telling, and it can be tricky, especially with addiction narratives. A lot of this is about navigating stigma. Building trust is really important with folks in active addiction, and also people in recovery or loved ones of people in addiction, because stigma against people who use drugs is so intense, even now when everyone supposedly knows someone. So you want to assure the people that you're interviewing that the story is not more important than them as people. If they're not comfortable talking at all, cool. If they don't want to use their last name, also cool. Most of the time, in my opinion. I wouldn't base an entire story on someone who wouldn't give their last name, but I can use an illuminating quote from their interview or use the information they've given me to flesh out more reporting. Journalists have a general rule that everything is on the record until you and an interview subject agree that it's not. I'm a little more careful about that rule in my own reporting, unless I'm talking to public figures or elected officials, in which case, sorry, you're on the record. But for people who are in active addiction, or people who have lost loved ones, basically ordinary civilians who might not have ever been interviewed for a newspaper before, I try to explain the process up front, like what it means to be quoted, when and where this will appear in the paper, and most importantly, that it's okay if they don't want to talk or give me their name. I try to treat people, just anybody I'm talking to, as kind of the expert that they are in the situation, especially people who use drugs in Kensington. I find a lot of the time when I'm doing sort of like cold interviews, like just going up to someone on the street, it can be really tricky sometimes, because people will assume that, you kind of you want to show like everything horrible happening in the neighborhood or everything horrible happening to them, and that you are trying to do sort of like a sordid kind of just like, look at how horrible this is sort of story. When I go up there, I'm generally not trying to do that because I think that's reductive, but also because, you know, people who use drugs are experts on the subject of, you know, the drug market and the drug trade and what the drugs are doing to them, especially in a place like Philly where, you know, so much of the drug supply is contaminated with fentanyl and other additives. So I ask people specific questions about like, hi, I'm writing about this specific topic. Can you tell me about your experience? And that really helps people open up. And it also makes them feel less like they themselves are being scrutinized. And it's more that we are having a conversation about an issue that's affecting all of us. So yeah, some people are fine with talking about this. They're fine with having their picture taken. Others are very not. And that's really okay. Your story is not more important than a person's autonomy. And, you know, there's gray areas as well, especially when you're talking to people in active addiction. You might have to make an assessment that this person is not in a state to consent to being interviewed or being photographed, even if they are. And, you know, you might run into a situation where someone is perfectly fine with it all and, you know, is happy to talk to you. And then a year later will come back and say, it was horrible that you put me in the paper. And, you know, it was horrible that my family saw that. So I think when you're talking with sources about consent and about what to expect, you should be really honest and open with them about, you know, like, hey, this is going to be online. People are going to be able to Google this. And that's something that you owe sources, especially sources who've never been in the paper, to say up front, and you have to respect them when they don't want to talk to you because of it. I also think there's a lot of pressure in this particular overdose crisis to sort of overcorrect against stigma. The narrative, people who got addicted to opioids in the early aughts are somehow less to blame because pharmaceutical companies and doctors were the ones pushing the pills. Try as best as you can to avoid this. It's important to identify what got us to this specific place and time, and the overprescribing of prescription pills is a huge part of it. But people who got addicted because they tried cocaine at a party or something are just as deserving of compassion and equitable care as anyone else. And when we sort of play this kind of blame game in terms of a single person's addiction, we risk creating this false dichotomy of who is deserving of sympathy and support and who's undeserving of it. I don't always do this, but most of my reporting, I try to highlight solutions to aspects of the overdose crisis, especially in Philly. Like I said earlier, some of the conditions the crisis has created are so shocking that there's an instinct, especially for people who come here from out of town, to just say, like, look at this is horrible. You know, especially when we had some of the encampments in Kensington, there was a ton of reporting from, you know, a lot of national papers that, you know, I felt really leaned into the voyeurism and less to the, you know, just kind of telling it like it is, this sort of the tragedy of this human suffering in this neighborhood. So it's important to highlight, obviously, what's happening in the city. But, you know, Kensington's a very visible place where drug use is very visible, and there's drug use all over the city that is happening in living rooms and in basements and bedrooms that nobody really sees. And it's like, it's certainly reported on less, and it's still like a really important and pervasive part of this crisis in Philly. Something like 75% of people in Philly who die of an overdose die in a private home. So like what we see in Kensington is the tip of the iceberg, and it's really important for reporters and media professionals to understand that. Yeah. Oh, and also, sorry, it's important to also to, you know, while you're exposing an issue, to also highlight a solution. It's also important to highlight what's not being done. A lot of the research that I write about has to do with how fragmented and siloed our addiction treatment system is, and how a lot of people aren't getting the care they need. And also, you know, you're dealing with grief and trauma and stigma while you're out reporting on your own. A lot of our job is about interviewing people at the absolute worst moments of their lives. And especially when we're talking to people about addiction and overdoses, it can be really meaningful just to acknowledge the situation, how awful it is, and to commiserate with the person that you're interviewing. Stigma is still really pervasive, and lots of parents I interview feel like they're being judged for the way their child died. Validating that experience can be really empowering for them, and ultimately builds a better connection and can get you a better article. You also have to take care of yourself. These are really heavy topics. It can be really difficult to hold it. So check in with yourself and your support system and acknowledge when you're feeling low. And also, you know, if you're reporting in the field, you know, you're in the field, carry Narcan, like carry Narcan, take it with you all the time. I've only ever had to use it once. It was horrible, but I was really glad that I had it. I think that, you know, we're reporters, and there's sort of an instinct to not become part of the story, but again, someone's life, someone's autonomy is much more important than your story. So that's something you should do. And then, sorry, I'll be quick. So rewriting the style guide. I and another reporter at my paper, Aubry Whelan, who also writes a lot about addiction and mental health, helped rewrite our style guide on addiction earlier this year. And it was a really instructive process. So in general, what we do is default to person first language, but we allow people to describe themselves the way that they like. So if someone wants to call themselves an addict, that's kind of something that's kind of a thing in like some of the 12-step programs, like that's really meaningful to some people. So if that's how they describe themselves, like we will quote them describing themselves that way. I myself would not use the phrase addict again. We use person with addiction. Again, like person first language, emphasizing that this is a person, not a condition. We don't use addiction, sorry, we don't use addict, and we also don't use addiction and drug dependence interchangeably. Addiction is characterized, like Sean said, by compulsive drug use despite harmful consequences. Dependence is the physical condition in which the body experiences symptoms if drug use is abruptly stopped. So you can be dependent without being addicted. And if we're not sure about that distinction, we just use person who uses drugs. We don't say drug abuser in connection with drug use. This is stigmatizing language. It can keep people from seeking help. In general, we try to explain the issue that drug use presents and the context of the use instead of labeling it. And one exception is because this is America. You know, there's a lot of institutions in this country that still have abuse in their names, like drug recovery organizations that still have like abuse in the title. So we still have to use that because that's just what it is. We use substance use disorder as a synonym for addiction often, or sometimes to use the substance specific, referring to substance specifically. So like opioid use disorder, stimulant use disorder. And we try to avoid saying sober or sobriety unless someone is describing themselves as such. People who are describing themselves as sober are generally abstinent. Recovery is a more inclusive term, and it acknowledges that, you know, you can be in recovery from one substance but have no problem with another. And of course, we avoid pejorative terms entirely. I mean, reading some of my own paper's previous coverage on this and the kind of stuff that we used to print is really embarrassing. And I'm glad we don't do it anymore. So I'll leave you with this quote from Maya Salovitz, who I know Sean also referenced. She's great. She's a writer on addiction, and this is from her piece for NPR when the Associated Press also stopped using the word addict in their coverage. She said, when the media start treating people with addiction with the same respect that they use for other patients, and when we cover addiction care with the same skepticism about possible quackery used in other health reporting, that's also super important. Just, you know, really, really reporting on evidence-based treatment has been a big part of my reporting, and it's super key, especially in this realm. It's like sort of medicalized and not medicalized, and there's a lot of stuff out there that doesn't work and that rope people in anyway. Anyway, she says, perhaps the rest of America will start to accept that addiction is a medical problem and that moralizing and punishment have failed. So thank you guys. Thanks for being here. Sorry if I went over time. And here's my contact information if you would like to chat with me. I'm always around.
Thank you so much, Aubry. I mean, it is refreshing, and I'm sure Sean would agree with me. It's refreshing to hear such a compassionate reporter and to hear your willingness to sort of bravely share, which, you know, in some cases can be critical of others reporting, but you're doing it in an attempt to help people learn. And we are just so appreciative of that. And I also want to say thank you so much for mentioning about naloxone. Allie did put in the chat how to get naloxone for free. So, you know, if you are running stories and you're out in the field reporting, please do make sure you have it accessible either in your vehicle or on your person. I'm going to try to wrap things up here really quickly because I know we really only have a minute left here. But there's a couple resources I wanted to make sure that you all knew were available. The first is a language guide. This is from a national nonprofit organization called Shatterproof. Shatterproof is dedicated to reversing the addiction crisis in the United States. And in this guide, you'll find examples of some recommended language. You'll also find examples of stigmatizing language and some good explanations behind those word choices to help you understand why it's stigmatizing or why it might be a preferred or recommended choice. Then the second resource I wanted to share is a set of trainings called Reporting on Addiction. It was actually already mentioned by Sean in his slide deck. It's a set of trainings available for student journalists, for media organizations, for addiction experts, research-based organizations, and others. It was developed by media professionals who share the same passion to decrease stigma and to improve the media's portrayal of the disease of addiction and of recovery. They offer one-on-one trainings and trainings for newsrooms and course lessons even for high schools and colleges. So, we don't really have time for questions. We're already a minute over. I'll make one quick ask. If you ever are covering addiction in your stories, please, if at all possible, include the Pennsylvania Get Help Now hotline number that's available 24/7, 365. The number is 1-800-662-HELP, and it's available for anyone to get connected to resources any time of the day. It's so important that we get the word out there that help's available just a phone call away. If you have any questions or would like more information, if you'd like to see, other copies of the slide deck, please do feel free to contact us. Sean and Aubry did provide their contact information already, and I think Allie and Steph, we're going to put our email address there in the chat. So contact any or all of us if you have any questions. Thank you so much for joining us for this really important webinar. Appreciate your interest, and we're always happy to continue these conversations if you have follow-up questions. So thank you so much, everybody.
Thanks so much. And as Secretary Smith said, I dropped an email address in the chat over there. Feel free to send any messages to us, and we're happy to distribute to the other panelists. But thanks again for all the panelists today, and thanks for all who joined. Have a great weekend, everyone.
Thank you, Sean and Aubry.
Thank you.